Hi guys, welcome along. Today we're going to talk about back pain and everything that you need to know, the musts, the essentials, the how-tos, the why-tos, right after this. Hey guys, welcome on to Fine Fit People. My name's Grant Goes, and this is a platform that helps you find the best professionals, events, and courses. Today we're talking about how to, all the information you need to know about back pain, the essentials, the how to fix, how to avoid back pain. Now, I'm not the specialist in this one. Of course I'm not. So we brought in a special guest to help us out. He's been here for 3 years. He started his own company called Bestrong. He's an expert in his field, and he's going to help us understand back pain. Please welcome Ivan Cirkovic.
Yeah, you pronounced very good.
Hey, there we go. Welcome, Ivan.
Thank you. It's my pleasure to be in your show.
Oh, it's brilliant to have you here, mate. It helps us lift our standards when we don't know what we're talking about. Let's go straight into it, because you've started up a new company within the last 3 years, which is fantastic. What's the aim and objective for Bestrong?
Yeah, so we start company actually. I start company with my friend and partner from the college, because we are colleagues from Faculty of Sport Physical Education in Serbia. Our occupation, or let's say our role, we are not only personal trainers. We are actually professor of sport physical education. Yeah, sounds very powerful. We're considering us like personal trainers because also we're qualified for that, and we have like so many qualifications related with the physical activity and training. But let's say we like to say that we are like a movement specialist.
Awesome,
yeah.
Excellent. Yeah. And it's great because these days you have to get more specific. You have to get more educated when everyone starts off as a personal trainer, for example, and they get more and more educated and they get far more specific, and it helps the business as well, right?
Yeah, true. So especially, I like to change the term trainer. I would like to say that we are personal coaches more, because we are really like a coaching people.
Totally.
So we are really educating them to feel better, to move better, without the pain, of course.
Yeah, and you guys actually run workshops as well.
Yes, we started last year with the workshops. We did like 4 workshops, and it was quite successful, because it was like more than 30 people in every workshop.
Yeah.
This year will continue.
Awesome.
with more specific subjects. Last year was like a more like about general approach to training and assessment and strength, mobility, stability, and all things what's related with the good training. Yeah.
Totally. Well, you're out to find out exactly. He is a very educated man. So we're going to talk about back pain and everything that everyone should know about back pain. When we talk about it, obviously, it's such a common thing in this day and age that people have back pain. Yeah. Let's maybe start with a bit of why do you think that is for today? Why people are getting so much back pain or having back problems?
Yeah, that's actually a good question. But if let's go like one step back.
Okay.
Yeah, just one step back, because when you see the public researches now everywhere, just Google it, you can find that there's a 90% of back pain it's non-specific, and only 10% is specific. So that means that some kind of degenerative procedures like disc bulge, disc herniation, this kind of stuff, or any kind of issue. But to be honest, I don't like to use the term non-specific pain, because in general, if you say non-specific pain, that means that you can just know the symptoms. Okay, we are trying to find the cause for that pain. So let's say example, if you go to see the doctor and you say, I have a headache, and doctor will give you medicine to actually heal or to cure the symptoms or consequences, not to find the cause. I'm not saying all doctors, but let's say this is one of the examples. So the same about back pain. We are focusing on finding the cause. If you find the cause, then you can change the moving pattern to reduce the pain, of course, and strengthen that area, or release if it's necessary. It
was also a much better idea to fix the problem instead of cover it up. A lot of people just put a Band-Aid on it and send them on their way, kind of thing. Yeah. So that's brilliant. So then, what is you experience the most common type of back pain? When people say back pain, the back is a big part of the body.
So that's quite huge and big question. So but let's start from the zero. What is actually for us basics? Also, in our workshop, I try to explain our clients and our colleagues as well.
Brilliant.
So we're using one theory, we're calling that joint by joint approach. I know if you heard about that, it's this theory it's invented by Michael Boyle and Gray Cook. They're one of the most famous, I think, movement specialists in our world. In the world. So when we talk about the back, it's a different thing. So different part of the back provides different kind of functions.
Totally.
So for example, the most common is lower back pain, but lower back pain from the point of that theory providing stability. For example, thoracic spine, like our T-spine, providing mobility. So when we approach these kind of problems, we need to know what is this joint made of and what is their function.
Yes.
If you don't know the function, there's no point. So this is one of the reasons, like quick example, it's like why we're doing like a deadlift. Deadlift is not exercise from the lower back, it's exercise from the hips. But we're keeping lower back straighten and stiff because we want to be stable.
Yes,
so the things are quite simple. So when you see also in this picture here, it's different. So also, for example, if you're talking about the back, for example, shoulder blades, they're stabilizing. You know, so it's always like that. Going like one joint is stabilizing, one is mobilizing. So this hip, it's mobilizing. Knee, it's stabilizing the body. So if you go through these procedures, it's quite easy to know what to do.
What's going on? When do you think people are? Because mate, it's a great point you brought up between mobilize, stabilizing that. With people, like you always hear very common that people get a deadlift, they do a deadlift and they hurt their back. Because they're not stabilized in the right place or not mobilized in the right place. What is it? Because I'd like to go kind of more about, start with a bit of a, how to avoid some of the common issues that people face, right? Which is they deadlift or they pick something up off the ground incorrectly. And next thing you know, they
So naturally, our spine want to flex. So we're doing like a flexion. So when you're talking about like, for example, lower back stability, it's not about only lower back muscles, because if you just look in that area, you cannot fix almost anything. So you need to look the core. Famous word core, everyone using core in every possible way. So core, it's very complex. Core is stabilizing our movement. So if you're looking, for example, spine, we need to check. So also look like the front part of the core or like abdominal muscles, also side part of the core, the obliques. So, and of course, back side where you have like erectors and extensors of the spine. So we need to look that very, very like specific. So we cannot just approach, okay, this is the best exercise for that. There's no best exercise. Before every kind of advice, we need to do assessment.
Massively.
So assessment, it's mandatory.
Totally.
Mandatory. So if you want, I can explain you how we are doing that. What kind of principles?
That'd be cool.
So we're using like a certain principle. We have like 6 principles of for assessment. So first one, it's a principle of information. So information, it's related with the history of any kind of back pain or any kind of problem with the potential client or just learner. It depends on what you want to do. So information is related with their pain history and with basic information like, for example, is there any kind of fear of pain? Because we know the neurological component, it's very important. People are also afraid of the moment if they have some kind of like pain history. Second principle, what we're doing, it's a principle of identification. This is where we're doing actually assessment. And assessment, it's based on checking the movement patterns and also like muscle imbalances. We're using also one very specific method to check muscle imbalances, because sometimes muscles around the back, any kind of muscle can overwork for other muscles.
Totally.
So I can give you some examples, but maybe we can save it for later, what kind of cases we had. Third principle, what we're using, it's individualization. So that means that we, from that assessment, we need to like find specific exercises or specific movement patterns for that person. So we cannot just do it, okay, this is what I know someone says you should do it. No, so it's everything's based on that. Principle number 4, it's related with the periodization. So this is how we actually manage the program in the microcycluses, mesocycles, or if it's possible macrocycluses, but that's quite difficult in Dubai because people traveling a lot, so it's very difficult to organize the program. Fifth principle, it's realization. So when you're really actually doing that, applying that, so that's a very important part. And the last one, I think it's the most important one, it's principle of modification. So because you need to be ready for every kind of situation. Sometimes client will come with just some specific pain and you didn't plan that for your training. So you need to be very fast to modify that.
Flexible.
When I'm talking about modification, it's also a very important thing in preparing the program. It's it's actually regression to progression. So that progression, regression, for example, it's not only about the weights, it's also about starting movement, it's about the range of motion, about the leverage, about angles, about so many biomechanical things what we need to put in that training.
They go into that training.
Yeah.
100%. When it comes in, people always the people you find at train, they analyze themselves, and they try, oh, this is my problem, this is what happened. Like, it's quite hard. How do you get past that? Because I know, guys, there's a lot of things that we all go through that are like going, oh, we know the problem, but we don't actually know the problem. Like, say, for example, how difficult do you find with the assessment? Do you find it to get to the truth? You know what I mean? Because people don't tell a lot of information. Usually people go, oh, it hurts.
Yeah.
You know what I mean?
True.
You sound like a very, very in-depth assessment, which is fantastic.
Yeah.
I mean,
so we're doing, for example, one test. It's like a questionnaire. We call that the kinesiophobia test, actually fear of movement. When people have like some kind of back history, they will write. Actually, it's like they just mark how they're feeling. For example, do you feel that you will get injured if you start to move? They will write yes, completely agree.
Yeah.
So we're doing that like initial like a question, and then after 1 month, when we do like reassessment, the results are completely different because they allow themselves to move. But generally, people are sometimes not remembering their injuries, especially if they have some kind of big accidents, for example, scars. Scars can tell us a lot. Especially, usually people want to forget that because it was like something like a bad memory. So when we try to investigate deeper and deeper, they're, oh yeah, I remember I have a scar here, and that was because of this, and that. And I have like an old injury, and then we start opening up. It's also about the trainer, actually, or coach, how you will approach it, because you need to be very patient, because sometimes people coming like, okay, I don't want to find anything bad in me. Yeah.
Because I don't want to go into lower back pain yet, because it's not just about lower back pain, but you talk about such a stabilizer. What are some of the common injuries you're seeing on the upper back, for example? What are common injuries that are out there that people can avoid?
Upper back, it depends what you mean about upper back. If that's related with the shoulder blades or like a T-spine, we can see something like kyphotic position with people, how they're sitting. So usually they're like, you can see like a flex position in that area. So that's pretty common in almost everyone.
Totally.
Of course, these kind of things are related with the different factors. So when you talk about the muscles, we finding very often in that position, when people have like a protracted shoulders in front, usually we're finding a lot of problems with the pectoralis minor muscle, who is like usually very facilitated or like overused. And people think if they want to correct that posture and all these things, they should treat the muscle in the back. It's not always like that.
Totally.
Yes, because our body is connected with the fascially related. So there's a certain fascia in our body, and they're all connected. So it depends how you pull, body will react in a certain way.
Exactly.
So we found that, for example, like very typical. So we are not using manual technique, but mostly using like it's like a lacrosse ball, this kind of things that people can do it on their own as well. And this is the thing, of course, and strengthening of this part of the back. For example, one interesting information, usually with people doing like a pushing and pulling exercises, usually they should focus more on pulling. So this relationship should be like a 1 to 3. For example, if you're talking about the weights, about the repetition, doesn't matter, but always we should focus on pulling exercises. So typical injury for that area, we are not seeing a lot. It's more about the postural, this kind of discomfort when people cannot, I'm feeling pain in my neck, or I'm feeling, So that's, from that point of view, we cannot define, okay, this is exactly the injury we have.
Totally.
Of course, we can have some kind of herniations and all that, but that's quite rare. Before people come with these kind of conditions, we need a confirmation from doctor of sport medicine or physiotherapist. So
I think it brings up a great point that it's not just about that one area, it's about the rest of the body as well. We are connected to throughout the body. People go like, oh no, it's just my shoulders. It's like, well, actually, it could be down from a lot of your feet. I mean, really, working their way up their body.
If we open that subject, it's possible. Sometimes people have a problem with the shoulder, but they have a problem with the ankle. So it's connected. So it's completely like, our body is actually perfect machine, but sometimes we don't know how to use it.
It's like, same with the back and the pain that people are having. How do people tell the difference between like a spinal or joint pain and muscular pain?
So it's different. So we have one term we're using, like when people are dealing with the software, we can help. Software is like a muscles, and this kind of disbalance is what we can notice. If it's hardware, I'm talking about the bones and joints, we cannot treat that. We can just help through the process. So we are, let's say there's a chain of, let's say, we like to say doctor sport medicine because they are looking things a little differently than, let's say, just the general doctors.
Yeah.
Doctor sport medicine, physiotherapy, then we like a movement specialist coming on the end of that chain. So if we have all the confirmation, for example, something's related with some hardware, like disc herniation or these kind of things, we can go through the process. If people just coming with some kind of non-specific, which we don't like back pain, we're doing certain tests to check muscle imbalances. So we can easily see through like a different procedures and protocols how body is reacting in different movements. So let's say to simplify, we need a kind of neurological reaction in that term. So for example, what we're finding very often people with the lower back pain, it's that usually rectus abdominis or transversus medius, who is a little bit even deeper, it's usually weak. There's no inner control, and we found that, for example, the quadratus lumborum or like a QL, it's overused. So if you find that in one client, definitely you know what to do, because definitely you need to little bit release quadratus lumborum through some kind of techniques and increase the strength of the rectus abdominis, so in general, like the front part of the core. So these kind of things what we are looking for in the clients. So if the muscle imbalance is present, it's quite easy to find connection.
What about from the let's say I feel like I've got back pain around my lower back, and I'm not too sure if it's muscular or structural. You know, how would I know that? Do I go to a doctor, or do I need to see a sports scientist? Who do I go see? Like, how do I know who I'm supposed to go see to start with?
It depends. So that's a famous answer what we'll tell today. Like, it depends. It's always individual. It depends of the amount of the pain. For example, there's a certain scales where you can measure your pain, but people, because the fear sometimes, they're saying like instead of 1 to 3, they would say like a 8 to 9 to 10. So which is like almost
drama queens.
Move. But always if it's really something like, for example, mechanical. For example, you're doing the deadlift and you feel some crack, some like a sharp pain going through your leg when like a nerve is damaged. Then you need to see the specialist. Also do some kind of like a screening if it's necessary. If that pain is not specific, I just woke up with a back pain. We can solve it quite easy. That's quite easy. Or some kind of acute pain, if it's not too hard, let's say like a sharp pain, we can manage it. Chronical, we can see sometimes people just after like a few trains, they can feel, okay, I don't have any more back pain. Because when you're treating the back pain, it's not about the back, like I said before. It's also about the hips, how we're using your hips properly. If you're like quite mobile hips, you can do so many things. So it's not only one joint.
There's a lot of terms that's thrown out. Let's go back into the lower back pain, because there are a lot of terms that always get thrown out. People say, I slipped at this, or there's muscle strains. What are these? So people understand. You know, I mean, people go like, they have no idea. They go, I strained my muscles, but have they really, What is a strain?
Disc. There is some new research that's saying that the disc is possible to regenerate on their own. It's not confirmed officially, but we saw some researchers because we are following all this stuff, what's going on. But in general, disc, it's like a sponge. It's like amortizing actually the pressure. There's one information. So whenever we wake up in the morning, we are taller for 2.5 centimeters.
Oh, really?
So but then when we stand up, actually the disc is compressing and they have a problem. So disc like this, it can be the big problem, but the bigger problem it's a nerve, because nerve can be affected with that injury as well. Then people have this kind of like a numb leg or numb, even like a back and that area. So in that case, we need to focus, on this connection. What I said, we need also confirmation from doctor sport medicine, physiotherapists, and they know what we can do. We cannot do anything on our own. And of course, I personally have a clients with a disc, herniated disc, and we are exercising almost normally. So it's nothing like a danger. It's not like a life threat. Everything. The problem is sometimes
some people think it is.
If you go to see the surgeon, his job is to do surgery.
Totally.
It's not his job to tell you don't do surgery. Our job is to give as much as possible in terms of strength and movement patterns to avoid that.
100%. Then what does it say? Muscle strain. What is a muscle strain?
Muscle strain in terms of like a damage.
People always go like, I strained my muscle because I've overworked I've contracted these, whatever. No, they said I've torn their muscle. But how?
If you want to be honest, if you want me to be honest, when muscle is sore, that's actually muscle is damage. So muscle soreness, we can consider it also like a muscle damage. It's from the point of sport medicine, it's treated like an injury.
Yeah.
So muscle strain, it's actually when muscle fibers are broken and they cannot function properly. 100%. Then we have like one reaction when hematome. It's like a hematome. I think it's happening, and actually then what it's causing the pain because it's full of the blood and muscle are not still enough connected. When muscle strain, it's happening. Definitely you need like a certain procedures to recover. So you cannot go directly after training. There's a certain recovery, but that's quite, like I say, often situation what's happening to the people and they're coming to us. But the problem with muscle is trained. If you're not using muscle properly, after that you can have problem with other things. Like I said, for example, we have like one of our clients. She was complaining about the back pain, and we checked everything about the lower back. Everything was fine. Then realized that actually she's compensating with her next extensors because injury was there. So sometimes our body is telling us different information.
The thing with the people are going into things quite fast. I mean, like people get injuries usually because they jump too deep or to the deep end of an exercise, or they just go straight forward to that. What are some of the things that people can do to avoid these common back injuries?
So one of the, I don't like this kind of general approaches, but because it's from the expert, not me, the other one. There's Professor Stuart McGill. He's one of the specialists in like lower back injuries. If you find him, just Google him. You can find like three exercises. So you can find that like online, and actual exercises are quite simple. So he recommends that for everyone who's having any kind of back pain, to should do it like a daily. It's like a prevention. It's three. It's one. It's like he's like invented like a crunch. Crunch you should avoid in general, but his crunch, it's quite safe and it's very safe. Side plank and bird dog, but you should do it in that specific way. So you can just Google it, you can find that. This is what people should do it like a daily. But in terms of like a personal training, there's a certain things what you need to follow up. That's like a preparation for a training, like from warm up. When saying warm up, it's like a lot of mobility exercises. Not for lower back, so like for example for hips, it's very important for T-spine, and also like stability exercise for core. When you say about the core, we said it's not only about your abdominal muscle, it's about like a all line around.
100%. The comment, I mean, there's always people going commonly, they always avoid the things that they find they don't. I think the word I'm thinking of is useless, but I can't think of another word to say it, because they don't like, for example, a lot of people don't stretch because they thought it's not important, kind of thing. They don't mobilize because it's not important. But it is important. Like these things that people have this mindset about not being important are actually some of the most important things.
That's the thing, because people, especially I think guys, they want to go in gym immediately. Start with the heavy weights, all this, but it's very important to focus on stuff on this like pre-training, pre-main training like things. So mobility is very important. Why? Because in our joints we have like a synovial fluid, which is actually it's like an oil in a joint, giving like option to move. With the bigger range of motion, protect us from kind of like a joint injury. That's we increase in temperature in our body, and when you have like this working temperature, we are avoiding also injuries, and muscle is like better prepared. About stretching, it's a little bit tricky thing. Stretching can be good or bad. This is like the famous like answer. It depends.
Totally.
So we talk about static stretching after training. It can reduce the performance, especially we talk about the strength. So when you're doing like a static stretching after training for any kind of part, if you're talking about the lower back, don't do it too long. So 5 to 10 seconds is enough per muscle group, not more than that. Also, don't do static stretching before training. Focus more on dynamic stretching. So dynamic stretching today, it's like a fancy word. It's mobility, and stability exercises are also part of the training, especially if someone have like dealing with the back pain, especially lower back. We should focus on a lot of mobility exercises. Stability exercises in different kind of. So now we have different kind of like from the planks, side planks, dead bugs, so many different exercises. But again, general approach is difficult to explain. Specific approach, it's easy for us to explain.
We get some of these more specific things. What is something that someone could do? Let's say, because main area we're going to look at right now is about the hip joint. Around that area there. I mean, there's always a common problem so many times. I mean, people having hamstring problems, even glute problems, everyone having lower back problems. haptic problems on top of that. So without generalizing, because I don't want to generalize this whole thing, but to warm up, suppose not warm up that area. What things can be done? Because about prevention. Prevention is better than cure, right? So it's like if you guys out there, but more of a better a little bit better understanding, not as specific, unfortunately, because we haven't got that much time. But what's some of the things that they could do to prevent like these issues around that area?
Yeah. So one of the common things, what we're seeing, for example, lower back pain, when we're checking mobility and strength on muscles around the hips, it's usually weak glutes. Yeah. Weak glutes are very, very, very common. So this is the thing, people sometimes when they're even super strong, you can see that the glutes are very weak. Also neurologically, when checking this with this protocol test, we can see that there's no reaction. Yeah. So there's also like a Dr. Stuart McGill mentioned that there's some kind of term that's like a gluteal amnesia. Sometimes glutes are completely forgot to work.
Oh, really?
So yeah, if you look anatomically, for example, when teachers and in the college, so the muscle who is having the biggest cross section can produce the biggest force. So what do you think? Which muscle is the biggest? We have biggest cross section in our body. It's a glutes. Imagine how much force glutes can produce, and we're not using that properly. So glutes are actually one of the stabilizers, also external stabilizers of the lower back.
Totally.
So that's very important part. Also about the hip in general, we're talking about different parts of different glute muscles, like for example, who are like abductors of the hip, for example, gluteus medius, which is like very important. Yeah. And other muscles, of course, from you said like hamstrings and all that. Yeah, they are important as well, but like when the muscles are closer to the joint, they're even more important. So I think the glutes are very important, especially for guys. They're trying to avoid to do like a glute exercise. It's for women. No, it's not for women.
Massively avoid it, don't they?
Like really, like glutes are one of the most important muscles now because it's the center of the body. It's stabilizing everything around.
100%. Yeah. I mean, let's go further into it because I think for everyone out there, it is like a bit of a nail on the head that is such an area that is so neglected. In today's world, it's a little bit more brought in, but it's seen as such it's only a female thing because guys like booty or whatever. Yeah. Just so you know, guys, girls like booty too. I'm just saying. It comes to guys.
True. That's very common. Literally, we can see I think every second man is like with the weak glutes. You can see this. They're just focused on upper body. I think guys, crazy. You should try to focus more on the legs and glutes. They're very important. Yeah.
What are some of the maybe one or two of the more important exercises they can do for the glutes?
For glutes, so one of the most important and most like a commercial one, it's definitely hip thruster. Yeah, what people like to do. Squat, it's very complex exercise. In my opinion, squat is not for everyone because it depends of the hip joint, how is he's made of. For some people, squat is great. Yeah. So if they can want to improve more like a strength of the glutes, and unilateral exercise are very good, especially. We can mention again like a hip thrust on one leg. It's amazing. Yeah. One of my favorites, it's like a split squat. Yes. Split squat, it's one of the best one. Again, if you want to hit more glutes, there's a certain positions where you need to find. So you put your leg a little bit longer, so it's further from you, actually from the center of gravity, then you hit a little bit more glutes. If you go a little bit short, you hit more your quads. Nice. So this is like a small tricks and angles where you can play with. Yeah. Totally. So let's say these two are actually the most maybe important and very useful.
Do not neglect the glutes. Do not. Very important area. I was going to say we're actually running around out of time, unfortunately. But we'll get you back on to talk about some more about what we're talking about here with lower back pain because it's so complex and there needs to be more specificity and not so generalized. But hopefully, guys, you've picked up a lot of general information. Let's start just to start with, and then we can get more and more understanding, more and more specific. They can find you guys Bestrong.
AE.
Bestrong.ae. You can find the website there. There's 7 amazing trainers that are part of the company and developing and helping people get better and healthier. Ivan, just got maybe a last tip from yourself as far as back pain goes. Do you have any final tips?
Final tip, you need to be active. Yeah, you need to be active. There's no excuse for that. So 100%. There's no excuse. No compromising about that.
I couldn't say it. That's perfect. Perfect. Can't sit down and do nothing. Guys, thank you very much for joining us. Thank you very much to Ivan for joining us today.
My pleasure.
Absolute pleasure.
Great experience.
Learning a lot more things too. I was like, wow. I've been in the industry for 20 years and I'm learning more and more. So it's brilliant, fantastic. Great. Guys, that's actually not everything you need to know about back pain. There's much more to learn and understand. So we're definitely going to bring Ivan back on to go through a part 2 for this side of things. But guys, thank you very much for joining us today. If you have any comments, questions, chuck them in the comment section down below. Remember to hit the subscribe, like button, and that notification bell to get more videos like this. We're on daily, every day. Fine Fit People has got new shows for you to learn more, see more, and understand more. But until next time, guys, thank you very much, and tune in next time.
Goodbye.
We've all been there, hours searching the internet, asking friend upon friend, making call after call, trying to find the right fitness professional, health specialist, or sports coach. So much time, energy, and even money spent only to find more problems than solutions. Well, now, with the Find Fit People platform, you can find all the available professionals with the skills you need in an instant. We've removed all the barriers by establishing a community of many different skilled health specialists, sports coaches, and fitness professionals that are alerted immediately once you've posted your request. In under 30 seconds, you can attract multiple professionals with the right skills to help you achieve the result you want. It's simple, fast, and free. Find us online at www.findfitpeople.com or download the Find Fit People app from Apple or Google Play stores so you can find fit people today.